Hi, everyone. This is Steve Dallison, and welcome to this week's edition of CEOs You Should Know. I am thrilled to be joined by Dr. Fandos, the CEO of Alluring Age, Anti-Aging, and Wellness Center. Dr. Fandos, thanks for being here today.
Thank you. Thank you for having us. We're very happy to be here.
We're excited to jump into the conversation, learn more about you, and of course, learn more about Alluring Age. I know Alluring Age is on a mission to redefine wellness, with aesthetics taking a different approach, fixing you from the inside out.
Exactly. Yes. So my path into functional medicine and regenerative medicine started well before we started with Alluring Age. So, because I'm a pain management specialist by trade, I've been doing this for 25 years.
Wow.
Treating patients with chronic pain, but also always doing the same thing, which is treating symptoms as opposed to looking at the root cause. And then the eye opener for me was when I had a health condition where I was diagnosed with diabetes and then high blood pressure. And then eventually I was told that I would need a stent in my heart. Imagine that. And the worst part is that I was told that there was nothing I could do about it, that I just have to see it idle, wait until that time came and get the stent. So that didn't sit right with me. And it opened my eyes on how reactive our healthcare system can be.
Sure.
And because of that, now I cannot look at the healthcare system the same way anymore, because it's a system where we wait until something happens to you and then we work backwards trying to fix it. So that's at the center of what we do now. We looked at root cause, trying to identify what the issues are, and then working on prevention and empowering people to reclaim their health before crisis forces them to.
That makes sense. It's a great approach. How did that initially start? Like, how did your perspective on patient care evolve to be more focused on that root cause rather than the way that the industry currently does it? Like you said, like the retroactive approach.
So, like I said, I've been doing this for so many years, and I always found that even though treating pain on someone's journey is not a small thing to do, but it's just treating a symptom. It's not going to the root cause of the problem. So my perspective on patient care has completely transformed as I have shifted to a root cause personalized medicine.
Sure.
I learned that no two patients are the same, that everyone brings a unique history, lifestyle, physiology, and a set of underlying factors that shape their health. So looking at only one symptom or one diagnosis will never give me the full picture.
Mm-hmm.
So when you focus on the whole person care, meaning deep diving with comprehensive diagnostics, and not just standard blood work, and utilizing specialized testing, reveals what's happening beneath the surface. So when I understand why my patients have that symptom, I can then treat the root cause and not utilize a protocol, which is one size fits all that you see in traditional care.
It's a great approach. I know that probably developing that, you've had to try to find the balance between evidence-based care as well as emerging therapies and different tools to make sure that patients have that safety, but also those long-term results. How did you find that balance between those two?
That's a very good question. So emerging therapies are probably the most important part of my practice, meaning these are new therapies. Some of them really well tested, some others not, but the industry has been shifting towards this, and now there's a lot more research going on. I believe that innovation and safety must coexist. They don't have to compete. So every new tool or therapy I introduce goes through the same process. It must be supported by solid research, real-world outcomes, and a clear benefit to the patient. So I start with the foundation, which is evidence-based medicine. Then we go through comprehensive diagnostics and a full understanding of the patient's physiology. And from there, I'll layer in emergent therapies only when they complete the science, to complement the science, enhance the long-term results, and align with the individual patient's needs.
It's a great approach. I'm sure that obviously with this model, things are a little bit different than some of the more traditional trend-based wellness approaches, right? What makes your physician-led integrative model different from those that are out there?
So our body is a system of systems. In medical school, unfortunately, we're trained in silos. So we go through cardiology rotation, then GI rotation, then pulmonary rotation. And this is how we look at medicine once we graduate.
Sure.
we feel that that's the only thing that you have to focus on. And then if a patient has an issue with something else, you go to a different specialist.
Yep.
But in functional medicine, the nutrition, genetics, regenerative aesthetics are interconnected systems. And that all of those influence how a patient feels and how a patient heals. So regenerative aesthetics is already a major part of my practice because it aligns perfectly with root cause medicine.
Mm-hmm.
It focuses on cellular repair, collagen restoration, and supporting the body's natural healing pathways. So by combining all these insights with genetics, metabolic data, mitochondrial testing, we can come up with personalized a plan of care that really focus on that particular patient, which is different from another patient. So it's not a one-size-fits-all approach.
Totally. And what you said is so true. You'll go to like a cardiologist and they only talk about this, and then you have to go to this specialist to get this treatment. So it's a really smart and strategic approach.
It is, because all the conditions that we suffer from, all the illnesses, they have the same common denominator, which is inflammation. So if we learn about inflammation and what causes that, then, by addressing that, you can hit multiple different conditions. So that's why it's so important to use a comprehensive approach that includes all these specialties.
That's awesome. So looking ahead, obviously this is a very strategic way to approach it. How do you see the future of personalized, data-driven health evolving over the next few years, the next decade?
Data-driven, it's very important in any specialty and any industry. Data is king.
Of course.
We say it everywhere. And obviously health is not separate from that. So we're moving towards a healthcare system where prevention becomes the priority and not anymore the side conversation. So more clinicians are now recognizing that waiting for chronic illness to develop is costly, is ineffective, and emotionally drains the patients. So the next decade will push for us to identify problems earlier and intervene before the disease fully starts. So we're also going to see that precision medicine becomes part of the standard medical education, and that's a great hope of mine. I am currently an assistant clinical professor at Hofstra School of Medicine in Long Island.
That's great.
And we're really pushing for a curriculum change where this holistic approach becomes part of the day-to-day medicine and not alternative medicine anymore.
It's a great idea to be able to train all the future doctors to be able to incorporate it within their best practices.
Exactly. So realistically, the next decade will bring a more integrated model where earlier detection, more personalized interventions, better use of genetics and biomarkers that are now available to us, and a stronger emphasis on prevention is the true foundation of healthcare.
That's awesome. I know that we spoke a little bit about the education piece, right? Playing that piece in the long-term strategy. How else can patients participate in that? Like, what is the patient empowerment play for their own long-term strategies?
That's a great question. And this is something that is at the core of what we do. In traditional medicine, you're used to go to your cardiologist, your pulmonologist, your GI doctor, and you're given a pill, and you're good to go.
Yep.
And that's it. So in functional medicine, education and patient empowerment is absolutely central to the long-term strategy. When a patient understands their body, their diagnostics, and they understand the why behind the symptoms, they become more active participants in their own healing, not just passive recipients of care. That shift alone changes long-term outcomes. So for me, education is not an add-on. It's the foundation of what we do. When I teach patients about root cause physiology, mitochondrial health, genetics, nutrition, lifestyle patterns, they gain clarity and confidence, and they stop feeling overwhelmed, and they start feeling that they are in control. So empowerment leads to better adherence, better decision-making, and ultimately better long-term results.
That's awesome. And I'm sure with this different approach to the patient strategy and to medicine, sometimes there could probably be misconceptions. What are some of those biggest misconceptions people have about optimizing their health and their longevity?
So the biggest one right now is believing that a single approach will cure everything. As you might have heard, peptides is it's like the new topic.
Everyone talks about it, yeah.
It's been talked in the gyms,
Yep.
in meetings, when people go out to dinner, they all talk about peptides, and I get this question all the time. So we can't believe that a supplement, a peptide, or a pill is going to fix everything.
Yep.
People often think that there is a shortcut. A single product will undo what years of stress, inflammation, poor sleep, or environmental factors have done to your body.
Mm-hmm.
So supplement and peptides are really powerful tools. I use them in my practice all the time, but they are only effective when the foundation is solid.
Mm-hmm.
Real change comes from understanding your environment, your habits, your stressors, and the patterns that actually drive your dysfunction. So it requires lifestyle shifts, consistency, and willingness to address the root cause, not just the symptoms. So it is a job. So you have to really get involved and understand that not one thing is going to fix your problems. It's a new approach to your health.
Yep, it's looking at all those different aspects and not just that singular lane. What's one piece of advice you would give someone that wants to take a more proactive approach when it comes to their health?
That's a great question too. So in the world that we live today, where we're always on the run, we're going to work, we have family, we have kids. Many times you don't feel normal, but you normalize that. So what I'm saying is, do not normalize how you feel. Your current symptoms are not just the way you are. Your body is always communicating. It's always telling you something. So when something feels off, it's because it is. So listening to those signals is the first step toward taking control of your health. So get curious, ask questions, seek real answers. A proactive approach starts by understanding what's happening beneath the surface through deeper blood work, comprehensive markers, genetic testing. So by understanding all of this, we can look at the root cause and identify the problem. So take action. Don't wait for things to get worse or for a diagnosis to define your next steps.
Yep.
The earlier you intervene, the more power you have to change the trajectory of your health.
That's great advice. So what's next? What is next for Alluring Age Anti-Aging Wellness Center? Is there any exciting developments or expansions on the horizon you could share today?
Oh, God, how much time do we have? Yes, we have so much going on.
That's awesome.
It's which is great, and it's daunting at the same time, because you want to make sure that whatever you bring on, it's the right thing to do. Yes, we're preparing to integrate more advanced therapies. We're bringing in hyperbaric oxygen therapies, transcranial magnetic stimulation. We're actually already administering a therapy. It's called EBOO, which stands for extracorporeal blood ozonation and oxygenation, which is basically it's an oil change to your system. So what we do is we put an IV on one arm. The blood comes out, goes through a machine, gets filtered, gets cleaned out, gets oxygenated, and goes back into another vein like a brand new. So this is a great therapy that we utilize, and patients are loving it. So, and all these new therapies help us to deepen the level of care that we can offer and continue to move toward a truly comprehensive root cause wellness model.
That's great. Sounds like a lot of exciting stuff. You're busy.
Yes, very busy. It's like nonstop.
Well, we covered a lot about the industry and obviously about Alluring Age. But if there's one thing you want people to take away about your mission, what would that be?
Okay, so my mission is to show people that prevention is not a luxury. Okay, so prevention starts here and starts now. Personalized medicine is not an alternative, it's the future. So you deserve a care that looks at the whole picture, listens to your story, and empowers you to take action before the crisis forces you to do so.
Absolutely. Get ahead of it before it becomes a bigger problem than it needs to be.
100%.
Someone was tuning in and they want to find out more about Alluring Age. What should they do?
So you have to start with understanding that the symptoms are not the norm. Your body's not working against you. And you can rewrite your health story starting now. If you're ready to take the next step on your health journey, we'd love to connect with you. Follow us on Instagram and stay inspired and informed. Explore our website, alluringage.com. That's Alluring, ALLURING, age.com. Or you can call us at 631-909-6036 to speak to our team directly.
That's awesome. Looking forward to connecting.
Thank you.
I always love to throw in one bonus question. If someone's tuning in that might want to get into the field of medicine, and maybe it's advice you've given one of your Hofstra students before, what advice do you wish you had when you first starting out that you'd love to give to those inspiring people within the industry?
So the advice is that you have to really want to help people feel better.
Mm-hmm.
But not only that, you can help them to look better and age better by treating root cause, not just the surface. So by empowering patients with education, personalized data, and a proactive approach, they feel that the aging is a process of renewal, not a decline.
Yep, it's great advice.
Thank you.
Dr. Fandos, thank you for being here today. We really appreciate you giving your insights and your expertise, and we're excited to see what's next.
Thank you so much for having us.
Appreciate it. And thank you all for tuning in. Tune in next week for next week's edition of CEOs You Should Know.